Whether your health insurance plan is fully insured or self-funded, there's one thing I can tell you for certain, and that's that 5 out of every 100 people enrolled on your health insurance plan, they're going to drive 60% of the costs. Those are your large claims. Here's the translation. If you're not building in a strategy into your health plan to manage large claims, you might as well put your money on black at the roulette table because you're gambling. To illustrate an example of this, I want to share a recent client success story. So this particular client has about 150 members enrolled on their self-funded health insurance plan. And they have one ongoing large claimant that has a terminal condition and is on a $20,000 a month drug. In addition to that, strong likelihood at some point that this individual may need a transplant. And if they do, it's going to be about $1 million transplant. This year, we got their stop loss renewal, and the biggest surprise that we got was a $1.2 million laser. Now, this client's stop loss deductible is normally $100,000, which means they're only liable for the first $100,000 of a claim, and then the stop loss insurance company picks up the rest. But because the stop loss insurance carrier lasered this person, their liability was now $1.2 million instead of $100,000. And to put that into perspective, this client last year only spent about $900,000 in total on their health insurance plan. So this one individual was going to more than double their potential liability for the following year, which very well could have put this company in bankruptcy. And what we did next with this client was not implement just one strategy, but multiple strategies. First, we marketed the stop loss coverage because we felt that the laser was too excessive. Now, this particular employer has direct primary care. And what that meant was that we were able to connect the stop loss underwriter with that member's primary care physician. Now, I don't want to understate how big of a deal this is, because the primary reason that stop loss carriers laser an individual is because they lack data. In the absence of data, a stop loss underwriter is going to be conservative and load the rates. The marketing still resulted in a laser from the new stop loss carrier, but that laser was reduced from $1.2 million to $225,000. Just based on that additional data. We're talking almost $1 million less in potential liability. This is why data is so important and you need to demand access to it. Now, for most employers, this win alone is something to celebrate. But success doesn't come with just one-year decisions. You gotta think in multiple years. So we added a couple more strategies that would protect this employer in the long run. First, they bought a separate organ transplant policy. That means that if or when this large claimant needs a transplant or any other member needs a transplant, it's going to be 100% covered under this fully insured transplant policy. Not a $1.2 million laser, not a $225,000 laser, not even the normal $100,000 stop loss deductible. This means that the employer would have zero liability when this member gets a transplant. The catch: this person was excluded from that policy the first year because they had a known condition. So now the next strategy was implemented. And here's what we did. We offered a solution that provided a free, separate health insurance plan for members that qualify. Because of the condition and how much this member was spending on healthcare in a year, they were able to meet the qualifications of this program and were able to qualify for a separate free health insurance plan. It doesn't cost them a dime, not through employee contributions, not through out-of-pocket expenses. So now think about that. They have no barriers to care anymore. They are not enrolled in the employer's self-funded health plan for the next year, saving the employer the $225,000 laser minus the cost of this program. So this employer is protected for the next year. And guess what? At the end of next year, maybe that member comes back on the self-funded health plan when they need a transplant, because now we have a fully insured policy that's in effect that will cover the cost of that transplant for that individual, removing the liability altogether for that employer. It took 3 strategies to protect this employer from this one large claimant on the health plan. It also took some exceptional communication to the member to make sure that they understood the program that they were opting into. So my advice is simple on this. If you're not building a strategy around your large claims, you might as well go to Vegas. Instead, build a health plan that stacks the odds in your favor and go find an advisor that has your best interests in mind and is going to help you build that health plan.